Okay, we'll go ahead and get started. Welcome, everybody, and thank you so much for joining us today. My name is Greg Wallenius, and I'm a professor in the Department of Environmental Health here at Boston University School of Public Health, and I'm also the director of the BU School of Public Health Program in Climate and Health. I'd like to start by thanking our co-sponsors for today's event, the BU Initiative on Cities, the BU Urban Program, and the Program on Climate and Health. I'd also like to take a moment to thank the key members of the team that made this event possible. They are Catherine Lusk, David Gross, Evan Curris, and Devin O'Donnell. Thank you all so much. Before we welcome our moderator and our guest for today, I'd like to provide a short introduction to heat as a public health problem to give us the context for today's conversation. Okay. So, as we all know, the planet has been warming rapidly through the result of anthropogenic carbon emissions or human-generated carbon emissions. And on average, surface temperature from pre-industrial times has already increased by about 1 degree Celsius. And the consequences of this is that as the climate warms, there are more opportunities for days that are hotter and more frequent and more extreme heat waves. And this has real consequences at wherever you live, in every community, virtually every community, we're seeing more days of extreme heat. And we've seen this in the past, and we project that this trend will continue into the future such that by the end of the century, there'll be virtually everywhere across the country, there'll be many, many more days of extreme heat. So this matters to our environment, but it predominantly matters to our health. What you see here is just from a recent publication showing that as daily maximum temperature increases, that's degrees Celsius on the x-axis, the relative risk of going to an emergency room for either any cause or for heat-related illness starts to increase sharply. And so the hotter it gets, the more people that are at risk. And we saw this very clearly through the Pacific Northwest heat wave of last summer, where although the total number of people that died or had to be hospitalized is not yet known, had a substantial, very visible public health impact. So what we know from extensive science is that days of extreme heat are linked to more deaths, more emergency room visits, and more suffering. This is a significant public health problem. We know that even days of moderate temperature can pose a substantial risk to people's health. And while everybody is at risk, the risks are not equitably distributed. That is, some people are at much greater risk than others. So there's a tremendous amount of research on this public health problem, but there's no easy answers in practice. So that what I hope we'll learn today is take away some lessons from those cities and communities that have been at the forefront of this conversation, and experts that can help us understand what additional research or what better research might be useful in connecting the gap or bridging that gap between the extensive research and what we actually need for policy and action on the ground today. So with that context in mind, let me introduce to you Catherine Lusk, our moderator for the discussion today. Catherine is co-director and founding executive director of the Boston University Initiative on Cities, which spearheads university-wide programs and research, including the National Menino Survey of Mayors, place-based experiential learning for students in multi-stakeholder events, a champion for urban research and education across, a champion for urban research and education across BU. Catherine came to BU after serving as policy advisor to late Boston Mayor Thomas Menino. Catherine, thank you so much for leading us today, and over to you.
Thank you so much, Greg. Thanks for context setting and for the kind introduction. Hello, everybody. As Greg mentioned, my name is Catherine Lusk. I'm the co-director of the BU Initiative on Cities, and I have the pleasure of moderating today's discussion. I'm going to start by introducing our panelists and asking them to turn on their videos. First, we are delighted to be joined by Daphne Lundy, Deputy Director for Social Resiliency at the New York City Mayor's Office of Resiliency, where she leads work to create programs that strengthen and prepare communities against climate change impacts, including awareness of heat waves and heat risk in vulnerable communities. Welcome, Daphne. We're also joined by David Hundula, Chief Heat Officer at the City of Phoenix and an Associate Professor at Arizona State University. His research focuses on social and health effects of hazards with an emphasis on extreme heat. And finally, we're joined by Dr. Karen Smith, founding partner at Healthy Community Ventures, a consulting collaborative that helps communities build capacity and realize their vision of community health. A visionary physician, Dr. Smith previously served as the director of the California Department of Public Health. Thank you all so much for joining us today. A quick reminder to folks in the audience, I am going to try to take questions. I usually try to keep an eye on them throughout, so I'll go back and forth between my questions and ones that you guys are submitting. Please use the Q&A function, and I promise to leave also additional time at the end to try to get in a few more questions from the audience. So I wanted to start by just getting an understanding. You all have worked at different spatial scales and communities. Sort of there's great heterogeneity in the geography you have served, the type of populations you've served. And so I'm wondering if you can each sort of take us into the community or take us into the state or the region of the country you worked in and are working in, and give us a sense of the scope of your role, of your office and your position. And also, give us a sense of what are sort of the tools in your arsenal as you're working to address urban heat, whether that's heat emergencies or really trying to help the community live and adapt with heat. And I'd like to actually start by talking about cities. So I'm going to start with Daphne and then go to David, and then I'll turn to Karen to answer the same question from a state level perspective. So Daphne, give us a sense of sort of the scope of your role as you're trying to work with the community to address heat and heat emergencies, and also some of those tools in your arsenal.
Sure thing, and thanks again for organizing this conversation. So I'm at the mayor's recently renamed Mayor's Office of Climate and Environmental Justice. We had a bit of a restructuring under the new mayor, and I'll say that a lot of what we do is sort of working at this intersection of translating science, so translating the projections that we're receiving from research partners in terms of impacts to folks around extreme heat or things like extreme precipitation. So we're in this translating role of taking that science and then figuring out how to implement policies and legislations. So we make sure that as a city, if we're investing in capital projects, whether it's figuring out where we're putting trees or where we're making upgrades to sewer systems, we're incorporating that knowledge into that work. And specifically around heat, a lot of my work and my team's work is implementing the city's heat resiliency plan. So Cool Neighborhoods was a plan that came out in 2017, and it was the city's first heat plan. And it's really focused on working sort of under two buckets. So the first bucket is really thinking about how we can target green infrastructure investments. So increasing tree canopies in neighborhoods where we know heat vulnerability is a big issue. It's also thinking about ways we can do things like increase the number of white roofs or reflective surfaces in certain neighborhoods. It's thinking about how we are strategic about where we're putting our cooling centers or when we're activating sites like that when there's a heat wave. And then the second bucket is really focused on preparedness and improving just overall understanding of heat risk. So how are we pre-summer providing training opportunities to certain neighborhoods, particularly where there are huge populations of older residents or residents that might be socially isolated, so they know what to do when there's a heat wave. So they know that when the cooling center is open or how to access the city's air conditioning programs, but basically making sure that people are just kind of understanding of what the tools are that are available to them ahead of a heat wave. And yeah, I think that's all I'll say for now in terms of how we function.
So I heard some physical infrastructure. I heard things like cooling centers. I heard green infrastructure and tree canopy. I heard capacity building and educating and training folks within neighborhoods, and then improving access to information. Those are sort of, did I miss anything? Those some of the big themes?
Yeah, and I think the one other thing I'd add is that we also function in this policy advocacy and legislative advocacy role, particularly on the federal level, trying to make some of the federal regulations work better for dense urban areas like a New York City, like a Boston, and trying to sort of, just make sure that we're able to sort of speak to the unique challenges that we're facing tackling urban heat.
Is there an example you can give of that?
Sure. So a big thing that our team has been working on is trying to push for reforms around the low income home energy assistance program, also known as LIHEAP. So, as I think a lot of folks know, this is a program that provides energy assistance in terms of a subsidy, so people can pay for heating. There's a section of it that's available for cooling, but it's typically underfunded and just not as well understood compared to the heating component. And so a big thing that we've been trying to push for is creating sort of dedicated funding for cooling assistance, particularly targeting low-income households, and then B, allowing for that subsidy to be used for energy and utility cost assistance. So some municipalities today are able to use HEAP to pay for energy bills and pay for an air conditioner. Currently in New York State, that's not the case. And so that's been something that we've been trying to push for. And I think that program in particular is a good example of how we're in this place of trying to retrofit a program to deal with climate change. Because that program started during the oil crisis in the 70s. And so it was a program, that was conceived before we were really grappling with climate change. And so now that our climates, particularly in the Northeast, are warming up, how do we make sure this program sort of is updated to meet those unique challenges?
That's a great example. Thank you so much for sharing that. David, compare, contrast, give us a sense, take us to Phoenix and give us a sense of the scope of your role in relation to heat and health, and are you using a similar array of tools, a different array of tools to try to tackle the challenge?
Yeah, thanks, Catherine and Greg and the entire team. It's an honor to be here, and good morning. Still morning here in Phoenix, where we are heading into the 90s today. The heat has arrived, and we're getting ready for the heat season that, of course, inevitably comes every year. I'll speak a little bit about the position here with the city. We have a new named office for heat response and mitigation. The office was created in the city budget last year, and we've really been operating for about 6 months. So we're still getting our feet under us in terms of understanding exactly how this office will function. But if I were going to attempt to describe our role and our vision, I'd use a lot of the same words that Daphne was using: translator, connector, trying to be a multiplier, looking for missed opportunities across different departments. When you ask the question about the tool in our arsenal, I was just thinking mechanically how we're set up here in city government. We're a part of the city manager's office. We have a staff budget and no other programmatic budget. So I think the number one tool in our arsenal right now has to be the tool of persuasion. Going to the departments that have the big budgets, the Park and Recreation Department, Streets Department, Planning and Development, Neighborhood Services, the groups that are implementing the types of services that Daphne was describing, and help find ways to make all of those programs a little bit more heat conscious. And I've been really pleased so far, 6 months, not pleased to see that there are these missed opportunities, but there are a lot of easy gaps to connect thus far between provider A and provider B, who are both doing something heat relevant. Can we just have a shared information resource between the two of them, for example? So we are still charting our course. We just had the city's first heat response plan passed last week, one of those buckets or half buckets that Daphne was speaking about, drawing some inspiration from the Cool Neighborhoods Plan. We don't have a comprehensive long-term cooling plan. Daphne alluded to some elements there, but we are at least happy to have a plan in place for summer 2022 in terms of those short-term heat response strategies. Some of the other elements are addressed in other plans, like our Climate Action Plan, Tree and Shade Master Plan. And I'm sure we'll have more conversation about this. I think one of the interesting roles, and Daphne, maybe you would agree, so understanding where the boundaries of the heat work are has been an interesting challenge just 6 months on the job. But thanks again for the chance to be here.
Is that, I have to, I mean, David, I'm struck by the fact that there isn't in Phoenix, Arizona, that you're in a new role in a new office and not yet at the point, it's not a criticism, but and at the sort of early stages of putting together a comprehensive plan for sort of, is it because heat is a more recent challenge those of us in New England are contending with, whereas you've just all been living with it right along, but now it's risen to a crisis level through climate change? Like, why do you think that the city is in, that the sort of eastern seaboard is in one place or the Northeast is in one place and Phoenix is in a different, just a different?
It's a fantastic question, and I think one worthy of more deep investigation. Yeah. I think the Southwest is, of course, warming rapidly like other regions around the country. And it could be argued that if few cities are urbanizing faster than Phoenix and the Phoenix metro area, bringing that aspect of climate change related to the urban drivers. A big motivation here, I believe, for creating the heat office was what we've seen in the health data. We have set records, unfortunately, for a number of heat-associated deaths in our county each of the past several years. And these aren't small increases that could be matched with population growth. We're up 450% here in heat-associated deaths since 2014. And we're a rapidly growing region, but not that fast, not even close to that fast. So I think seeing those public health statistics suggested to city leadership, while we have been doing a lot of managing heat is arguably second nature for communities here, but clearly we're not doing enough to protect vulnerable communities when we're seeing those patterns in the heat illness and heat death statistics.
Yeah, wow, that's extraordinary. And evidence of how important the work is that you're doing. Karen, can you give us a sense of, you worked at the state level, you're working at a community level, and then you also had this, broad authority over the state of California. I'm wondering, can you take us, give us some context today and some context from your role at the state? What was the scope of your work in relation to heat and health, and what were some of the tools in your arsenal working at the state level? Oh, and you're muted.
Thank you. You'd think after 2 years, you'd have figured out that you need to unmute. So I actually worked in public health, both at the local level for about 18 years, but then also at the state level. And so I can talk about both those. But I think a lot of the folks in the audience may not actually know much about public health. So we're just going to do a quick 2 minutes on what the core of what we do is. So the whole reason public health's even engaged in the conversation around heat-related illness is because of the illness factor. And really, public health's role is to look at risks to population health. So not necessarily individuals, but whole populations, and to identify those risks and then attempt to prevent the negative health outcomes of those risks to health. So overall, our focus is on prevention. However, we also do have response roles. And I think a really good example of that is to look at just in terms of what tools we have, what our resources are that we use. First and foremost is data, science, information about, we monitor and a lot of different health risks over time. And we monitor overall things like, what are the major causes of death? So that helps us identify new risks and emerging issues. And we really struggle when there is no data or a risk is a newly identified risk. And I think COVID gives you a very good example. A lot of the confusion, the misunderstandings, the sort of incredibly difficult to navigate communications that came out of public health was because we didn't really know. We really had no information about this thing. Heat's a lot like that. We only started looking at heat as a major risk to human health 15 years or so ago, and not very much even then. And so the other thing then that we do, we use surveillance. And that's why I said, when I say we monitor, that's essentially what surveillance is. We monitor a lot of different kinds of data. We monitor research data, but the biggest source of information about illness and injury and deaths comes from the healthcare system. And unfortunately, the healthcare system data is in the United States very much siloed away from the actual response entities, whether those response entities are other parts of government or public health. And it makes it difficult for us to get that information in a timely way. And that's why when you see a lot of, most of the data that comes out nationally about deaths and causes of deaths actually comes from the Centers for Disease Control, and it's 2 years out of date. And that's because that's how long it takes to actually get the data and clean it, make sure it's accurate, and then analyze it. The way cities and counties tend to get data is to have some of that. Larger cities and counties can do that because they've got some of that ability to do that themselves. New York certainly has a fabulous, New York actually has one of the best intersections between healthcare data and public health and the rest of government. Some places in the United States, it's virtually impossible for smaller cities, for example, to do that, to really understand. So that monitoring of data is a really big part of what we do. That helps us identify risks. The other then piece of what we do is what we call risk communications. And that's communicating not just to the public. That's the biggest piece of what we do. And you saw that throughout COVID. We also communicate to the rest of government. So when we first started detecting health as a risk, or heat rather, as a risk for health, our first communications were with the parts of government that are responsible for the potential ways to prevent those illnesses and deaths. And so, because that's rarely public health, there's very little that we do directly around heat, except for partnering with other parts of the response system. One piece that we do pretty much uniquely is communicate with the physicians and the rest of the healthcare system that's actually going to care for people. One of the reasons I really have issues with the data that we use to figure out, how many excess deaths, et cetera, is that we don't do a very good job of making the healthcare system aware of what heat-related illness is, when to look for it, and how to report it. It's also not one of the things that's mandated to be reporting. So it's really, we have to go in and actively pull that information. So those are some of the tools that we have. In addition to our partnerships per se is one of our biggest tools, because we really do work. We have an extensive partnership with throughout especially at the local level, with nonprofit organizations and the people who serve the most vulnerable populations. And the same populations that are vulnerable to almost every other risk are also the ones who are vulnerable to heat. But there are some unique ones as well. People who work outdoors, for example, are at high risk. And it's important when we think about heat, most of the focus is on heat emergencies. We're going to have 5 days in a row. It's really hot. People need to understand what they're doing. But what we've begun to understand is that the health impacts of heat are extensive beyond those critical. Just very high levels of heat over time has ramifications for people who have heart disease, who have lung disease, and many other types of, there are a lot of negative impacts to sustained heat. And so we really are trying to get a more comprehensive picture of what it looks like to approach heat. And that's why the sorts of mitigation measures that Daphne and David are talking about, those are so important. It's that really just decreasing heat impacts overall. The one thing I would say is both of those metro areas, we've focused a lot on heat injury there. In more rural areas, the challenge may be a little bit different and has more to do with sort of workers who are outside and can't, and things can't happen if they're not where they are, then those essential workers have to do their jobs. So that kind of gives you sort of the other thing that we typically have, the other tool we have is plans, response plans. David referred to that, and launching your first response plan. Ideally, public health is part of that conversation, because one of the things you need to know when you're actively responding is where is the worst impact happening? Not where we expected it to happen, but where is it actually happening? And that requires that you really have good communications between the systems that deal with individual humans and the systems that are measuring the heat itself. So I'll stop there.
Karen, I'll just jump in on your comment about the role of
I'm muted. Go ahead,
public health. I think here in Central Arizona, attention to heat, the genesis of our work on heat really started with the Maricopa County Department of Public Health and their surveillance program. And as their leadership has had ripple effects with cities and other organizations, I think we've seen a real change in the narrative, and it can be measured looking at the federally mandated hazard mitigation plan here in the county. In 2010, all of the heat mitigation actions in the plan sounded like public health aspects or roles, messaging and education, and that was about it. When we look now at the 2020 hazard mitigation plan, all of a sudden we're seeing zoning and building codes being mentioned and different types of sectors as the conversation, I guess, has become more inclusive beyond public health. So it's encouraging and interesting to reflect on that, hearing how you see the public health sector fitting into this larger dialogue.
David, do you feel like that was organic, or do you think that something changed? There was more awareness among leadership. Like, why do you think the table? I mean, I know what I know part of the, I can guess a part of the answer, but why do you think the table got bigger and there was a sense of we need more folks around it to actually solve the problem?
I think here there was, and like I perceive to be the case in New York City and other locations, I think there was good individual leadership. It just happened to be the case that the person in our epidemiology team saw heat as a problem, wanted to push forward that agenda. And there was something like a $50,000 grant from the Public Health Institute to the county health department that enabled them to convene a couple meetings, which could be seen as a major inflection point in the conversation here. Nothing too brilliant or creative. Individual leadership and a small grant, I think, really changed the course of action here.
Sure. I want you guys to talk about what success looks like. Greg talked about morbidity and mortality. David, you touched on that. Karen, you touched on that. When you think about your role and the array of tools available to you, how does leadership in your community at the level that you're working, what does success actually look like? Daphne, I want to start with you. What are you working toward? If not, success is the wrong word. What are you sort of ultimately working toward?
Yeah, I think the way that I approach the work is figuring out how we're minimizing harm. So, minimizing the number of people who are hospitalized, trying to address the numbers of heat-related mortality rates that we know happen every summer. And then besides that, also thinking through how moving forward, we're not exacerbating the issues that we're experiencing with extreme heat. So for that second bucket, a lot of the work that we've been doing legislatively has been sort of making rules around buildings, emissions, making sure that moving forward, we're doing things that help to, both reach our climate agenda and our climate goals, but in doing so, we're also addressing extreme heat. So, our ability to make certain investments in things like green roofs or push for electrification or push for solar, those are things over time that help to minimize the impacts of extreme heat. But in the present day, there's still the issues of people being hospitalized or people dying. So what are we doing in terms of emergency preparedness or messaging or doing outreach to unhoused populations? Like, that's the work that we're doing presently to try to minimize that harm. So I oftentimes find that it's like this work of working in these multiple time scales. So just trying to figure out what we're doing today, but also having that long-term view of, if we're in the 2080s and we're going to have triple the amount of extreme heat days, what are we doing now in terms of our buildings, in terms of our land use policy to get us to a better place, decades from now?
Yeah. Karen, I see you nodding. Does that that immediate, right, the immediate task and then the one that lies decades down the road, does that resonate?
Yeah, it really does. I'm gonna sort of address what does success look like from sort of more in my state level. So California is a really big, really diverse state, and success at the state level for the state, mostly what state public health does is we do a lot of trying to add our voice in support of policy. So the sorts of policies that Daphne was just talking about doing at the city level, we're also trying to do at the state level, so that when policy is coming out, and the good news is it aligns very well with some of the other priorities of the state. So climate change in general, that is quite the underlying issue. But also there is housing policy, as you also mentioned, there's land use policy, et cetera. And so in terms of having our message from public health able to fit into multiple different policy areas and say, and here is how your policy, the policy that you're talking about can impact health, both positively or negatively. And having that available to policymakers at a lot of different tables. The other place I think where what I would consider success would be if every locale, not just the big ones, not just the large urban areas, not the big public, well-resourced public health departments, had good plans for those emergencies when they did occur, because not everybody does. And nor do they have the ability necessarily to do the surveillance. And so that's another thing. We do a lot of preparedness planning, and we want to be sure that public health is lifting their part of the load for the overall planning for whichever, whether it's a county or a state or even a regional entity that's trying to be prepared to respond, but then also build over time. That's the other thing. Then finally, a lot of what we do at least at the state of California is research and evaluation of research. And so one of the areas where I think we really, there's a lot of kinds of research that we need to really understand health. In the straight up public health world, we have yet to come to really get a grip on what are the major effects of sustained exposure to heat. As heat emergency is from the medical perspective is easier. And physicians know we're in the middle of a heat emergency when somebody comes in with heat exhaustion. What they may not know is that person who came in with their asthma exacerbation it's in response to heat. Or their heart attack or their stroke, et cetera. Heat stroke is one thing, but cardiovascular stroke can also be increased by sustained exposure to heat. So we need a lot more information so that we can make sure that the people who are seeing people in entering are actually capturing that for us. Not only that, they also know to do the right thing, to check in and make sure that those people have, do you have fans? Are you socially isolated, et cetera, so that on the one-to-one level. But at a population level, it's really about having better data, because then that feeds back into how do you figure out whether what you're doing now works, right? That's easier than how do I know that the policies that David and Daphne are putting in place now or pushing for now are actually going to work? And to be able to do evaluation each time there is a heat event or a sustained heat, we should be gathering data, but we don't really do that. And we need to do that on a better scale. And that's where academia can really help us out as well, because the kind of research that BU does, for example, is incredibly helpful to people who are actually trying to plan for the future. Excuse me.
David, that's a good segue to you as an academic, still wearing his academic hat and now in City Hall. How do you think about what you're working toward? And,
I love everything.
And quality or lack of quality and accessibility in data as well.
Yeah, I love everything that's been said thus far about goals. Just looking at our plan, sort of on paper here, the goals for this summer are to reduce the number of heat-associated deaths in the city of Phoenix, and even understanding what that means. It took us a little time to think through reducing calls for service to our fire department related to heat. And to Karen's point, a goal to collect some form of evaluation data from each of the 30 different programs and services that are part of our heat response plan this summer, and even have a sense of what could that mean. And I think in some cases, this is going to be a conversation with somebody who is familiar with the program. And in other cases, there may be data streams that we can try to capture or create. So in terms of what is written down that we're working toward this summer in the short term, that's where we are. Yeah, I wonder if a long-term vision is that the city doesn't need a heat office anymore, and that students who are being trained through BU's programs and other programs are taking roles in local government such that whatever value add that Daphne and I have right now in our functions becomes mainstream in the planning and development process, becomes mainstream in emergency management, fire, police, these other practices. I don't know if that is the desired outcome, but I could see a successful world in which I can certainly see a successful world in which a heat office doesn't need much of a budget. And I can also envision one in which there might not be a need for a heat office at all.
Yeah. And I'd say that,
yeah, go ahead.
I'd say that we have a really good precedent for that. I think a lot of municipalities in the East Coast because of Sandy, had this injection of funding and thinking around flood resiliency. And so now at this point, at least in New York City, if you're at a capital agency, you have some grounding in flood risk because of updates to building code, because of updates to zoning, because of all of this energy that happened in terms of just understanding flood risk. And I think that it would be ideal to move to a place where it is embedded in all agencies. So like the Parks Department is obviously thinking about heat, or the Land Use Department or Buildings is thinking about heat. And so I think there is this desire to be at a place where it's just embedded knowledge across the board. And obviously there is the role of researchers and experts to sort of strengthen that knowledge, but at a fundamental level, you're thinking about this if you're in a place to make planning or investment decisions about projects in the city, or a city rather.
Yeah, there's a bunch of questions I want to try to string together. Folks what they're really asking about is efficacy. There's a whole bunch of questions about green infrastructure, about tree canopy, even about the use or underutilization of things like cooling centers, which are all sort of a variety of interventions. And you've all talked about a lot of different interventions, and I'm wondering if you can draw a relationship between some of the things you've talked about and the research. So where do you feel that the evidence, not just evidence on health outcomes, but you know, on mortality, to draw attention to the issue and get renewed scrutiny and renewed momentum around the issue, but where do you see the evidence really driving specific local action? And then I want you each to touch on that, and then have in your mind, and you can either do it at the same time or I can come back to all of you. Where do you not have the answer? Where are those big research gaps or evidence gaps that you think, I'm still kind of flying blind here, but we think the solution looks like this? David unmuted first. I'm going to let him go first.
Yeah, a big question here, a big multifaceted question. A couple of thoughts which hopefully partially answer the question. One, on the question about cooling centers and measuring efficacy, which is something that we are continuing to try to do with the State Health Department here, who's supported by the CDC BRACE program, which is a fantastic opportunity we're delighted to be a part of. And I think there is a successful future in which cooling center use is zero or close to zero. That would suggest that some of our other basic social services and housing infrastructure are doing their job such that other need is not met. So I think even understanding what success looks like when we're evaluating any particular program, we have a conversation to have there with our thinking partners in the academic space and with community partners as well. Yeah, in terms of, so when you're asking about evidence driving local action, I'll share one really specific example. That there are some community groups here, as I imagine in other cities, who are doing heat relief outreach, distributing water bottles, heat relief towels, et cetera, during the summer. And some of them have come to us and said, hey, we'd like to do more at your city parks, but it's a little cumbersome for us to do so for various reasons. And sometimes maybe staff are getting in the way or not understanding their role. Maybe in some cases, permitting is required to use vehicles, something like that. And they've said, we're very confident that we reversed at least X heat stroke cases last year with our outreach effort. And that was, I've been working with climate and health data for a little while now. And that was the first time a group had come forward with that measure. They said, we got in the way of a specific number of heat stroke cases, and we're using that as an argument to get a permit or whatever other sort of permission we need. And I wonder how many more opportunities there are like that out there, where instead of, or in addition to measuring the illness and deaths, we also have a case of, all right, when the fire department intervened, how many cases did we keep out of the hospital? That would be really terrific data to understand. So when we're asking city council for $100,000 or $1 million or $10 million, we can say, look, this investment is going to clearly have a high return on investment because we know it can prevent such number of cases. It feels like we're missing those data right now. It's really interesting to me that those data came to us from a community-based organization that is, it would not describe itself as data rich by any means, but they happen to have this really critical data point to make their persuasive argument. So that's how I'll start the answer to your conversation. We'll see where it goes from there with Karen and Daphne.
Yeah.
So I will just, one area where I can say we actually saw, and I'll go back down to the local level at this point, some success was very early on, probably 10 years ago or so, there was a heat emergency in the Central Valley in California. And the local health, it was a very small county, very poorly resourced. The local health official there gathered all the death data. It wasn't by any means of the size of, the kind of thing we'd need for statistical significance. But the thing that he found was that the major distinguisher of people who died versus people who didn't had nothing to do with their diseases. It had nothing to do with whether they had air conditioning or fans. It was social isolation. And that has proven to be true over many heat events in a lot of different places. It is very helpful because particularly in close-knit communities, it's the kind of information that we can use, public health can use in risk communications that say, hey, reach out to your neighbors, especially if they live alone. Do you know somebody? Call them, see how they're doing, check on them. The same thing can be said for, sort of first responder entities as well. So there's that. When it comes to where do we have questions, there are more questions than I could possibly list, but two really big ones for me. In the short term, and at the individual level, is what actually works. The fact that it's the same thing that David brought up. Knowing that you prevented X number of heat strokes is great. That's the kind of information. But do cooling centers work? When you get lots of people in a cooling center, does it work? Why don't we know why people aren't using the cooling centers? Is it because they don't have transportation, et cetera? So the big long-term question for me is, what are going to be the additive effects of a lot of different things that are changing, including more unhoused people? I don't see that changing anytime recently. How does the interaction of air pollution with longer stretches of high heat and then heat emergencies on top of that, how is that going to change the overall health impact, et cetera? So we have lots of questions that become very esoteric and difficult to even begin to address without things like, machine intelligence and a lot of really complex research.
Yeah, that's great. Daphne?
I thought I would have collected my thoughts in the time that David and Karen spoke, but I think I'm in a similar boat of just having a lot of questions or a lot of angles that this could go. Just to build off of one point that Karen made about sort of like the role of social isolation and trying to improve connectedness. I think that, as somebody who runs a team that's focused on social resilience, we see that as being really critical, the power of relationships, the power of, reaching out to a neighbor or, inviting somebody to your home to get, to cool down is important. But we oftentimes find that type of work or that type of impact is really hard to quantify, particularly when it comes to funding mechanisms. So, there are lots of funding mechanisms that we go after on the federal level, and oftentimes there are very rigid, sort of benefit cost analysis that's really about property loss or property value, and it's hard to incorporate the things like public health and like the intersection of climate. So that world of I think being able to sort of better communicate the impact of connectedness is something that I think we're still working on getting a handle on. I'll say that because of COVID, we know a lot more about that because of just the ways that people were able to reach out to each other. So in New York City, we have the Be a Buddy program that's part of our heat resilience plan. Mm-hmm. And that's been something that's been, in operation for a couple of years now. And it's a program where people would call, their neighbors ahead of a heat wave to share resources, talk about cooling center activation, et cetera. When COVID happened, those same networks are able to pivot and become sort of these wellness check folks who are able to do wellness checks to thousands of people in their neighborhood to tell them about food programs or to tell them about the air conditioning program. So I think now we're beginning to get metrics about sort of the importance of networks and having those networks in place well before, a disaster. So that's something that I think we're still getting a handle on. Going back to an earlier point around worker safety, I think that, nationally, we understand the impact of extreme heat and worker safety in certain sectors. So particularly, agriculture, gets a lot of that focus. But I think for a place like New York City, we're now learning that a lot of our outdoor workers, whether it's sanitation workers, people who do road repair, people who work in kitchens, they're oftentimes, experiencing long durations of extreme heat. And so, at the federal level, I think a lot of folks know that there is growing momentum for OSHA to create worker safety rules. But I think we're locally trying to understand, what do these regulations look like, given the types of industries that are in a place like New York City, in New York State, given the type of work, whether it's construction or sanitation, how are we sort of understanding that long-term durational exposure to extreme heat when it comes to worker safety? And then I think going back to the thread about, cooling centers, I think we've seen similar patterns in terms of attendance in certain places versus others. And I think what we find in the research is that a cooling center is only as successful as the programming in that space. So it's hard to activate a cooling center if it's in a drab building that people don't want to be in. But if it's in a library, if it's in a place that has programming, and it's a place that somebody would want to be in anyway, that's typically the elements that we see in more successful cooling centers. So I think historically we've done sort of informal counts to understand, how many more people go to a library or how many more people go to a community center. But I think fundamentally at this point, we know that programming is key. Having things that sort of drive people in a space anyway is really key to actually making the cooling centers, work and be active.
That's a great point. And I hope
Daphne,
Zoe Davis
should mention that, and tied into a narrative that's emerging in our conversation about COVID. I have to give a shout out to our neighbors in the city of Tempe. They activated some new cooling centers during COVID, and the staff at those cooling centers were from the Parks and Recreation Department because many of the parks facilities were otherwise closed. And because these are professionals who specialize in recreation, they specialize in creating a more enjoyable environment. Those cooling centers were widely seen regionally as much more successful, but by various measures, just because of who was there.
Yeah, that's great. I was going to just call out Zoe Davis was the one who posed that question in the chat, and I think you both gave some great answers to that. We have about 12 minutes left, and I'd like to do two things with that. One is I'd love us to start to specifically talk about vulnerable populations. And there's a lot of groups we could focus on, but I'd like us to talk in particular about the unhoused population in your cities and state and where the communities you've been serving. What does support look like? What do health interventions look like for people experiencing homelessness? And that's the first question I'm going to pose. And then there's a question in the chat that I'd like to get to about housing cooling interventions like air conditioning and cool roofs and other things that are so assuming then we pivot to people who are in a situation where they have housing. What are some of the best practices in sort of in-home resources? And I think the social, the buddy program, I think is an excellent example of something we wouldn't think about, but for people who are housed, but don't have a social network, that's a terrific example. It's not just about, but it's social infrastructure, not physical infrastructure. But I want to start with a bit of discussion about, and if there's other vulnerable populations you feel really passionately that you want to share some insight around and share some best practices around, I'd love to hear it. But I do want to spend some time talking about people who are experiencing homelessness and how your communities are working with them. I will let anyone go first who wants to.
I can start,
Okay.
Catherine. This has been an interesting conversation as we were pushing our heat response plan forward. So here in Phoenix, about 65% of heat associated deaths are among those who are unsheltered. And although it's really hard to get a denominator for the size of that population, our best estimate would suggest that an unsheltered neighbor is at 200 to 300 times higher risk of heat associated death than somebody who has regular housing. So off the charts in terms of these other factors that we've been talking about. And we think that the major increase we've seen in unsheltered here in central Arizona is one of the big drivers behind that 450% increase that we talked about earlier. So to me, these conversations are almost one in the same. And as I've been trying to understand my role here and the scope of this office, we find ourselves in the room a lot with the specialists from our homeless services division and human services who are, they're putting forward budget ideas for shelter investment and more wraparound services and so on. And it seems like every dollar that they would spend in that direction, every minute of effort they would spend in that direction is what we need to be working on to bring down our number of heat-associated deaths. Like that is the greatest return on investment, and figuring out how to support their work and not interfere in it has been an interesting part of the first 6 months on the job. When we look at the city budget for next year, it is not, if one searches the proposed city budget for the word heat, I'm not sure if someone's going to find anything, but there's 8-figure investment in homeless services. And that feels like a really important investment in our heat response efforts as well.
Mm-hmm.
So I think, and to go back to a previous question you asked about information we need that we don't have, there's kind of a real estate question. I mean, the city is an actor in the market, and one of the pieces of information we need is which buildings are available to us to lease, operate, and or purchase to create more shelter space and or affordable housing. And the real estate market here, as I imagine is true in many other places around the country, it's crazy. And it's been very difficult for the city to compete in that market to find more places for people without shelter to get out of the heat in the summer. So that's an answer that we're still desperately searching for.
Mm-hmm. You're reminding me, David, of a project out of University of Miami that they folks did in partnership with the city of Miami, identifying all of the parcels in the city that were owned either by government or nonprofits, including churches. And they found a vast amount of empty tracts, largely, that could be repurposed and used in pursuit of the public good by organizations that are committed to the public good with the right set of incentives and programs in place. It's a great point. Karen and Daphne?
Yeah, I mean, I would echo a lot of what David is saying, and I think he's also speaking to this, the short term and the long term piece again. So, in New York City, in the short term, when there is a heat emergency, our Department of Social Services and Homeless Services has a code red activation. So what that basically means is that people are deployed outdoors to either provide unhoused people with water or direct them to cooling centers or direct them to shelters. But I think in the long term, the solution is providing affordable housing to folks. And I think it goes back to the original point I think we were touching on about how do we embed this thinking around climate adaptation in all of our departments. So, as a housing department, if we're building housing, it's obviously to address affordable housing, but there's also this intersection with addressing how certain people are at risk if they're unhoused when it comes to extreme heat or extreme cold, which is something that we deal with in New York City. And then I think there was another question you raised about indoor cooling strategies. I think for us, a lot of that's been focused on the heat advocacy work. So again, trying to make this existing program work better. So, at the start of heat season, more people are enrolling in that program, more people know it's available, and we're getting more indoor cooling options to low-income households. I think it also touches on one of the comments that was in the Q&A about people not wanting to leave pets behind or going to or go to a cooling center. Mm-hmm. I think what a lot of the research tells us is that people want to stay home because they want to be home. They want to be in a place that's familiar to them or comfortable to them. And so to the extent that we can be sort of promoting safe indoor cooling, particularly for folks who have the fewest options in terms of cooling, I think that's a lot of the direction of our work as well.
Mm-hmm.
So one of the things I'd like to point out about the unhoused population is that it's not just heat emergencies where, you're going to have 3 or 4 days where it's really, maybe you can get by by taking people water, or, maybe even I've seen, generators that were running a bunch of fans for folks who are outdoors. I love the idea that we could use, in theory, some of the same strategies we used during COVID. We had a Project Room Key in California where there was, many entire motels either purchased or rented out. There is no money. I mean, that whole response was exclusively because the amount of money that the federal government put out to states that then states shared with locals. And that simply isn't going to happen in this case. What I worry even more about than the acute emergencies are the long stretches of high temperatures that we're looking at for people who are unhoused. Because remember, those people also overwhelmingly are people who have other major medical problems, whether that's mental illness, substance abuse, or in many cases, just, these are people who have maxed out, they've got diabetes, the same sorts of chronic illnesses that affect everyone else with far fewer resources. You don't have to exceed the heat emergency level to cause real problems for people with significant medical illnesses, over a period of days. When you have over 100 degrees and high humidity over 10 days, that has a cumulative effect on human health. And those are the deaths that we are likely to miss, because when those folks come in, they come in with an exacerbation of an existing pre-existing heart disease, for example, and now they're in heart failure. That's not going to be attributed necessarily to heat deaths. We miss those deaths. We don't count them. I worry a lot about our unhoused populations as the climate changes, and we have yet to figure out how to deal with it. And in California, it's a massive problem. Not exclusively in our urban areas, although a lot in the urban areas, but then also throughout the rest of the state as well, where the resources to even do things like take water out to people for days at a time are really limited. We have entire communities in California that don't have potable water. If you add heat on top of that, it becomes a really, really life-threatening situation. And those are people who are housed. So I'm glad you brought it up, because I think it's an incredibly important issue.
Yeah. I have 2 minutes, and I know I could let you go, but I want you to do one more thing for me if you'll do this rapid fire. I get asked all the time, how can I as a researcher influence policy or influence the policymaker? And in my experience, the answer is more than show up once with data or send an excellent peer-reviewed journal, which are important but not sufficient. And I'm wondering if you can each close with a parting word of advice for the research community, if you're really committed to changing policy and changing the minds and getting more momentum and attention and resources including for issues like heat and health, but in other areas. What is something you have each learned along the way about what really matters?
I would say straight up, partnering with governmental entities that work in your area, whether it's public health or planning or whatever it happens to be. If you've got good, strong relationships with government, you are automatically going to find out what's useful to government in terms of making policy.
Great.
And to build on that, we need to push Greg and our other academic mentors to create an environment where that is not only understood to be acceptable, that is desirable, right? That we see that as valuable part of the academic experience. And just to wear the geography professor hat for a moment, I made this error for 10 years working at ASU. Ask the cities what spatial scale they are making decisions at. So when we are creating maps, they are maps at the right scale, right? Like I've yet to find a decision I'm making at the zip code scale. And my whole dissertation was about heat deaths and zip codes. And like zip codes are very awkward for us to deal with. So ask about the spatial scale and try to align research to the scale of decision making.
Great. And Daphne, final word of advice.
Yeah, I'd echo all of that. Partner with government, consider working in government. We have researchers in our team think about the scale and make sure that the data and the scale lines up. I also think that there is a really amazing role for researchers and scientists around citizen science or advocacy in science. We've had lots of temperature monitoring campaigns with community organizations working with researchers, and that type of work is able to get the level of attention and advocacy that I think is really critical for sort of just changing the conversation or shifting focus. So all of those sort of avenues are great ways to get involved.
Awesome. Thank you. Thank you all. Thank you for getting that one last final question. Thank you for your incredible work and the wisdom and advice and insight that you shared in the course of the last hour. I really appreciate it. And I look forward to someday being able to host you physically at Boston University and meet in person.